today we're talking about topography-guided laser. What exactly is that, Dr. Joseph?
Yeah, so topography, basically, if you think about it from a geographical perspective, when we look at the cornea, which is that clear dome on the outside of the eye, we have maps that image the cornea in terms of its layout, so its elevation. We call them elevation maps. That, simply put, is topography. So where is it steep and where is the cornea flat? But we also go one step further and look at tomography. So tomography is the front surface of the cornea and the back surface of the cornea. So it's really important to put those details together when you're looking at vision correction procedures. Now, topography-guided laser is a step up on the old way of doing laser, where you simply put the refraction details in. So basically, if you're short-sighted, a -2, or if you're far-sighted, a +2, if you've got astigmatism of -4, you put those details into the laser, it works out a nomogram, and it does the laser on the cornea according to your refraction, okay? So using topography, however, we can now use the refractive data, so put the -2, the +2, the astigmatism value in, but also incorporate what the curvature of the cornea looks like and smooth out that cornea. So if you, for example, look at or think about it in really layman's terms, take a rugby ball, you roll it around in mud, now suddenly you've got this rugby ball with lumps and bumps all over it. What topography is going to do, topography-guided laser, it's going to smooth all of these lumps and bumps out so that this lumpy rugby ball is going to eventually end up looking like a smooth soccer ball. So when we talk about that in terms of vision, we're suddenly taking a system that may be seeing starbursts and glare and halo under night conditions, or there's certain other conditions like keratoconus and abnormal corneas that induce those phenomena. And we can then use this topography-guided laser system to smooth those abnormalities and aberrations out of your optical system to try and give you the best quality vision under all light conditions.
Okay, Dr. Joseph, that's very, very interesting. So why should we use it?
Yeah, so initially the process was for abnormal corneas. So corneas that have, for example, keratoconus. We can do topography-guided laser procedures. Keratoconus, remember, it's a very abnormally shaped cornea, a warped rugby ball, so to speak. So we can try and normalize the shape somewhat, which reduces that effect of ghosting and halos and glare. The corneas that have scars on them, a procedure called radial keratotomy was performed a lot in the 80s, which was a procedure for myopia or short-sightedness. So it's multiple incisions in the cornea, essentially to flatten the central cornea to reduce the short-sightedness. But the problem with that was it created a lot of nighttime vision problems, starbursts and glare mostly. And now we can use the topography to look at this cornea, to input it into the laser and say, right, change the shape of this cornea from an abnormal rugby ball shape or highly aberrated to a more regularized soccer ball shape, and reducing then your effect of halo and glare and visual aberrations that make it sometimes impossible to drive at night. The FDA, or Food and Drug Administration, has within the last 10 to 15 years approved topography-guided laser on virgin eyes, meaning eyes that have not had any procedures, that don't have any scars, that have never had radial keratotomy. And their results were actually phenomenal, showing that the outcomes were more stable than the standard, what we call wavefront optimized profiles, standard than, or better than any other profile that had been performed with regards to laser vision correction. And this is an approach we use on our wave-light laser, and I was fortunate enough to become really accustomed to that procedure whilst in Ireland. So you look at everyone's cornea, even if it hasn't had surgery, if the person hasn't had surgery, look at the topography, and if we can use that data to drive a vision correction procedure which optimizes your vision under all conditions, then fantastic. So that's topography-guided laser. So it's a fantastic tool to have in our armory, so to speak.
Yeah, wow, that's just incredible, Dr. Joseph. Now, next question, let's look at the types of corneas that can be used or that we can use to treat this.
So anything that has an abnormality to the cornea that induces an irregular shape. So things from keratoconus to scars from previous contact lens infection or any form of infection on the cornea. And unfortunately, some of these infections are central. And depending on the depth, we can't correct all of them with laser. And unfortunately, the really deep ones end up needing corneal grafts. But if they're superficial or shallow, then we may well be able to use laser to change the shape of the cornea and to take the scar out. Patients that have had previous radial keratotomy for short-sightedness, and of course, what's called contour revision. We use that on the Wavelight platform that we have in our office on virgin eyes. So we can now use topography-guided laser on a virgin eye to really get the optimal shape of that cornea to try and reduce any form of visual phenomena like glare and halos and starbursts with really, really great outcomes and exceptionally stable over the long term. So, anything from a highly aberrated cornea to actually a normal cornea, we can still use topography-guided treatments.
Fantastic. So that's topography-guided laser in a nutshell today on Medical Monday. Thank you so much, Dr. Joseph. Only one question left, and that's how do we get in touch with you?
Yeah, Jan, we're based in Knysna at the Advanced Surgical Center in Barracuda Street, and you can contact our office at 044-150-0085, and Mariska will be able to answer your questions. We have our website, www.drdylanjoseph.com, and we're also on YouTube, Facebook, and Instagram.
Dr. Joseph, thank you so much. That's another very informative Medical Monday. Thank you so much. Have a lacquer week, and we'll catch up with you again next Monday. Wishing you a wonderful and productive week.
Awesome, Jan. Thank you very much, and same your side.
Thank you.